Hello, hello. Can everyone hear me? Hello, everyone. Good evening. My name is Portia Barnblatt. I am a doctor of acupuncture and a TCM from San Francisco, United States. And I have been practicing since 1996. I have medical trainings both from US and China. And I do speak fluent Chinese. So I have done quite a few translation, the books from Chinese to English. And I have been actively involved with TCM education in China and worldwide within the last 10 years. I am a board member for a few medical TCM organizations in China, and I attend different conferences in China every year and preside over the conference for them as well. I also work with the TCM universities in China, Shanghai TCM University and also Henan TCM universities. And every year with AIA, we bring doctors, go over there for exchange program for trainings, and that has always been done very well. And the doctors who have been gone with us always learned so much, and they really enjoy the trip. I have a very busy practice in San Francisco. I used to work at 2 hospitals in San Francisco. One is the CPMC. We have the best rehab centers in California. We mainly treat all the post-stroke patients. So acupuncture is a big part in that hospital. We have lots of intern students with us, and this program has been going on for the past 20 years, and it's still going, which is wonderful. Due to my busy travel schedule, I don't work at hospitals anymore, so I only work at the 2 private clinics in San Francisco. I am also a member of Acupuncturists Without Borders in US team, and I have volunteered my work all over the world, and I really enjoy helping people who are in need. Tonight, I'm here to give you a short, brief introduction of this amazing special Taoist hand acupuncture system. This system is based on Asian Taoist acupuncture theory, and it has been handed down for many years from Asian Chinese Taoist masters. Among them, probably I think your group, there are many practitioners who practice Tai Chi, Qigong. You probably heard of this grandmaster whose name was Zhang Zhishun, who lived up 103 years old. He passed away in 2015. I had a very fortunate chance to meet him 10 years ago in the mountains where he lived. He was just amazing. He was seeing like 100 patients per day to treat using this system, and also his own hand therapy to treat all kinds of issues. So I followed him for 1 month in his mountains, which I've learned this system. It's just amazing. So this system regulates the entire body, especially good for pain management. And it is very good for GI issues and cardiac issues. As we all know as practitioners of TCM, so Taoism advocates the law of nature. And TCM theories such as yin-yang, 5 elements, and 8 entity of differential diagnosis are all based on Taoism. In ancient China, many great TCM masters are all Taoist practitioners. According to this special Taoist hand acupuncture system, there is no concept of disease. The so-called illness and disease are just due to the accumulation of various stagnation. All evil qi has its life length, and it wants to be released from the body. They don't want to stay in our body. They have their own lifetime, and they're not going to be too happy if they stay for too long. So we need to facilitate them to get out. So this special system only focuses on creating a tunnel for the body to discharge all this evil qi. This system does not use the word of treatment. Instead, it considers the door opening to let go of all evil qi. The ancient Taoist masters call it as benevolent acupuncture because they always carried a merciful mind when they used the needles. We are so grateful it has been passed down to today. It is all due to the compassion of these masters. So the main characters of these systems are, number one, they don't talk about meridian theory. So there is no meridian theory. It's based on a 3-section body mapping system. Number two, there is no differential diagnosis. Number three, it's focusing on the bone stimulation and needling through periosteum. And by doing that, it generates the yang energy. When you have enough yang energies, you can ward off a lot of diseases. As we all know, yang energy is the root of the body. It's very important. And this system treating the symptoms instead of disease. There are two main focuses. One is what we call corresponding points, which is the major of this system, and we will go into very much detail when we are actually teaching the lecture. The second one is discharging points, which is a very important. Remember, I just said because this system we focus on opening the door to release, to let the energy, evil energy, to go out. So those two discharge points are very, very important. The first one is called Shing Haku, which is very close to Master Tone's Lingu point, but it's still a little behind the Lingu point. Okay, I will show it to you. It's at the junction of the first and the second metacarpal bone, but it is right into this joint space. And when you needle, you have to make sure the needle goes through right into the bone, and patient will feel kind of strong sensation, and afterwards sensation is supposed to release all the way, goes out to the tip of the index finger. That is the sensation you need to have them to feel in order to get the best clinical result. The second one is called the lumbar sacral point, which release all the evil energies from the lower body, and it's between the third and the fourth metacarpal bone. It's in the joint space. It's at a junction right here. And when you needle this point, you make sure patient feel the sensation. The evil qi goes out all the way through the tip of the ring finger. Now, the best results for these 2 points, patient would feel, first they feel kind of cool, very cool or cold sensations, starting from here all the way down to the tip of the fingers. Same with the ring finger. Then they will feel the warmth sensation afterwards. So these are the best sensations your patient feels when they get the best result of the clinical outcome. Now, the corresponding relationship of this system. First one, the thumb. Thumb represents, okay, let's see. Okay, that's better. Thumb represents the head and the neck regions. Okay, for example, this area represents the vertex of our head. Okay, we have a 220 at top of our scalp. We all know. So the 220 point on this hand system is actually very, very close to lung 11. It's right here. Now, this area is around occiput region. So here is the famous hand Du 15, Shou Yamen. As we all know, to needling the Du 15, you need a very precise needling technique because otherwise it can be very, very dangerous. So I actually don't needle Du 15 on the scalp anymore. I only use this Du 15 when I treat lots of stroke, post-stroke patients, and it's very, very effective. And of course, here's just not for not only just for stroke. You can treat lots of related Du 15, whatever the functions that you can find at the TCM books, you can all treat. Now from here to here is actually the cervical region, cervical spine. Okay, so C1 through C7, you can find all the points which work so greatly for these issues. Okay, so that's the thumb. Index finger represents upper extremities. We can find the points, the mapping points, to treat all kinds of musculoskeletal issues on the young side of the thumb, and lots of internal organ issues on the inside of the index finger. So the middle finger represents the trunk on this side, the young side, okay? And actually the 3 jaw, upper, middle, lower jaw on the inside. And we use a lot of the points in this area to treat, actually to activate the 3 jaw, upper, middle, and lower, by only using the areas here to treat. There's one special point right here when you treat a specific lower jaw issues. For example, myoma for women and also prostatitis for men. This point right here. Let's see. And we needle a lot, and in combination with the second discharging point, which is right here. And you see instant results very, very quickly. Now, again, the needling technique makes a huge difference. You got to get certain kind of sensations in order to work on those issues. Also, on the back of the hand, here is cervical regions, okay? And here is the thoracic regions, lumbar, sacrum area, and coccygeal. Okay, let's see. Let me do I'll give you a case study. I had a patient, male patient, 2 months ago with a rhinitis. And right now we all know it's the spring season and we have lots of allergy patients. So his history, he had these issues for 10 years. It just started all of a sudden, and went to see many ENT doctors, took a lot of medication. It just nothing really worked. So every spring he would have all kinds of nasal congestion, headaches, and it just runny nose nonstop. It just feels very, very miserable. So he came to see me. We did a full checkup, everything. And so what my diagnosis for him, it was like more damp, cold congestions and also some sort of like kidney ion deficiency in his body. Okay, so according to the 3-section theories, because it's the nose, okay, so 3 sections again, top, middle, and a lower, which represents on the thumb. And it's the inside because the front is the inside. So we're looking for the points in between the first and second phalangeal area. Okay, so the nose actually nose point is right over here. So when you treat, you got to palpate and feel the joint space right in there, okay? And also, you need to check this point as well, the 215. There is a corresponding relationship between these 2 points. And also, you got to treat to use this new Haku, Shing Haku point. So this combination is what I used for him. 1, 2, 3. And only 3 visits. We treated every other day, and all his symptoms just went away. And I had him to come back in another 2 weeks, actually. Didn't give him any herbs, and he stayed the same, which was very good. He was very happy with the results. Now, this point, the nose point right here, you have to needle towards the tip of the thumb. Let the chi goes out this way. And this one perpendicularly, do 15 point. Okay? Now, Shing Haku, this point, when you needle perpendicularly towards the wrist direction a little bit when you first insert the needle. Then you turn the needle a little bit perpendicularly, then 45 degrees towards the tip of the index finger. So it's this way, and this way. Go all the way out. That's how you release all the evil chis for this case. So that was one case. And also for a cardiac patient, which I used a point in this area, right here. This is the heart region. And also by using needling this point, you actually can penetrate through all the 3 jaw from here all the way down to the tip of the middle finger. You get release all the bad energies out. And it's very good for tachycardia, and also it's very good for emergency case. For example, if you have a patient with a heartache, before you call the 911, before the ambulance get there, you actually can save the patient by needling just this just this point. Now, a lot of patients, you can also, of course, needling the PC6, which is very effective for all kinds of cardiac issues. But this point, many patients I found in US, they can't really tolerate. It can be very painful, and the numbness goes through all the way to the tip, can be very uncomfortable. But by using this point, actually is very effective, and patient has less complaint. So maybe you guys can try it in your practice, and let me know in the future how does that work for all kinds of cardiac issue patients. And also this point you can work with all the GI problem too. Lots of patients with the GI issues, all kinds of GI issues, when you combine with this point with a through point from closer to large intestine 3 all the way on the inside this way to small intestine 3. This is like a small circle of yin-yang connections. Okay, we usually do both hands at the same time. Now, one hand will be from large intestine 3 all the way to small intestine 3, and the other hand you needle opposite from small intestine 3 area through the large intestine 3. And it's because on the hand there are 3 sections too, and on the inside, like I explained before, it's all corresponded to the front of our body, and it's more treating internal organ diseases. So we definitely will go through every details of all the points and the diseases that we treat with the systems. Let me see how much time I have. Any questions? I'll be happy to answer some questions if anyone has the questions. see. Do I see it here? Okay, I don't actually see here. All right, good. So the needle size, usually you can use 0.35 millimeters, 1 inch, and also 1.5 inch, depending on the size of the hand and also which point that you are needle. Or you can use 2 inch needle. I usually use 1 inch. That's plenty for me. And also on the small space joints around the fingertips, okay, and also small phalangeal joint, I use 0.5 needles. And also usually for this system, all those masters in China, they emphasize you have to retain the needles for at least 1 hour. And they usually retain the needles for 2 hours in China. And the setting is very simple. You don't really have to undress patients, and you can do like a community acupuncture setting in your office for this type of hand acupuncture therapy. You can actually treat like 20, 30 patients in an hour if you are fast enough. That's what I do. I usually have one afternoon just to dedicate this type of treatment for low-income patients of our cities. So I do a community setting, have everyone sit in the office waiting room, and I only do the hand acupuncture treatment, which is very effective. And I let them stay there for like 2 hours. It's a very, very good therapy, and everyone enjoys that. Let's see here. So there are actually a lot more to talk about this system, but let's see. We pretty much almost the time is 10:22 here. So I have 7 more minutes here. Any questions? Okay, no questions. Okay, I will show another treatment for the knee joint, which is a very popular issues that we treat all the time. So for the knee joint point, you will do the corresponding point first, which is on the young side of this ring finger. It's right here. Okay, so you will feel these points palpate first, and many times you will find it's very sensitive on patients' hand joint area. And also these two space you gotta feel as well, and it can be very sensitive. Now for the inner knees, it will be this line here you gotta palpate, and that's the other side of the knees. So when you apply these needles, first you do it perpendicular treatment, okay, the insertion of the needle, and every 5 minutes you gotta twist a little bit. Then you for about like 3 times, then you leave it in for up to 2 hours, depending on how much time they have. And also you have to add on this lower discharging point. So only 2 or 3 points. That's it. That's all you need to treat the knee issues. I've done many treatments. It's very, very effective. So give it a try. And I think for the brief introduction for today, that is pretty much it for today. So we are planning a class on April 19th. I am looking forward to seeing you all then, and thank you so much for joining me tonight. It's a very difficult time right now. I wish every one of you take good care and stay healthy. Thank you very much. So there are 3 questions. I don't see the questions here. Okay, let's see. Okay, so what kind of needles that you recommend for this technique? So I use Chinese King Li type of needles. It's not too soft, which gives the needling sensation very, very thorough. I use that type of needles. I don't use Japanese syringe needles because it's just not enough stimulation that you can give with using this type of technique. So how are you treating joints and muscles on the hand? Okay, that we will have to go through the detailed corresponding points in a lecture, because there are many, and there are different locations. You have to know the locations and also needling techniques. I will explain that in the lecture. Okay. Let's see. Do you use electronic stimulation on the hand? No. Like I said, to begin with, first interval will be like every 5 to 10 minutes. I will go to stimulate using my own hands. No, manual stimulations only. I don't use electrostimulations for this type of therapy, and I was taught by those masters only use manual stimulation. Let's see. Are you treating both hands simultaneously or just one hand? If you only have the problems, musculoskeletal issue-wise, okay, for example, only one side. But to treat internal organ diseases, usually both hands. And we will go over these in a lecture in much detailed forms. All right, I want to thank everyone again, and have a great evening. I'm looking forward to seeing you on April 19th. Thank you.